In 2015, United Nations, through the World Health Organization, has taken a very important resolution concerning the reinforcement of emergencies management and also essential surgical care and anesthesia as a full component of universal health coverage. In another way, in another term, that means that now United Nations International Community for Health System has accepted to include in the system at the primary care level surgery, anesthesia. It has never happened before. Why? Primary care level surgery and anesthesia at primary care level. Because we have observed that billion and billion people in Africa lack access to surgery and anesthesia. A lot of death due to lack access to surgery has been noted. And everybody wants to change these patterns. So it is also the concern of our organization, the Pan-African Association of Surgeons. And from that observation, a new concept has emerged. Global surgery. Global surgery, that means surgery at the district level. Surgery at the community, rural community level. And PAAS has decided, since the resolution, the adoption of the resolution in 2015, to organize this international cooperation, international conference, under the auspice of the African Union, this international conference to have, from the African perspective, how we can settle implementation for Africa, implementation of global surgery for Africa. And doing that, we will have, at the end of this conference, really a plan actions. We will get the priorities bringing by the Africans themselves, the stakeholders themselves from Africa, define the priorities to be put in place for the implementation of global surgery. And for that purpose, our main targets are all those stakeholders who are dealing now with the improvement of surgical health care in Africa. This means the professionals, of healthcare system. This means the policy makers, such as the ministries of health, the ministries of finance, the ministries of telecommunication, new technologies, and the ministries for infrastructures, energy, water supply, electricity. All those ministries who are taking the control or the management of a very good environment to improve the health delivery in Africa. So it will be an international conference with all the people who are dealing directly or indirectly for the improvement of surgical care delivery in Africa, rural community, and district level, with really a powerful action plan. And this point of view, this vision, is going within the African Union Agenda 2063 agenda, to have at the end a peaceful, a prosperous Africa without poverty.